Hi, I'm Jim and I was retired. In this week's video, I'm going to look back at the decision I made 3 years ago to select Plan N for my Medigap plan, rather than go with the more expensive and more popular Plan G. And I'll also update my estimate of how much we'll pay for health care in the coming year when you add my Medicare costs and my wife's ACA premiums. We'll look at how original Medicare and ACA costs add up in 2025. Stay tuned. Now, the only change I needed to make during the annual enrollment period was sign up for a Part D drug coverage. You do that every year. I don't have to change my Medicare supplemental plan or Medigap plan because that is automatically renewed. It's guaranteed renew as long as you pay the premiums. But December is also my anniversary month, and so I'll let you know how much more I'm going to pay for Plan N in 2025. And I'll also update my analysis of what I would have been paying if I had gone with the more inclusive and more expensive Plan G when I turned 65. By the way, this is my most popular video on this channel with more than 115,000 views in the past year. When you sign up for Medicare, you're faced with your first choice. Do you stick with original Medicare with a Part A for hospital care and a Part B for doctor and labs, and then add a Part D prescription drug plan and a supplemental insurance coverage or Medigap policy to cover the 20% that Medicare doesn't cover? Or do you go with Medicare Advantage, a Part C that turns over your Part A and Part B to a private insurance company, which may add a Part D drug coverage and other benefits? If you go with this Medicare Advantage route, you would not shop for a Medigap policy because your Part C plan would include everything in a managed care model. Now, if you do go with original Medicare, though, you'll want to add a Medigap policy unless you have a retiree health care or a union plan that will pay the 20% balance. Medigap policies are standardized by law and are known by these letters. Now, I've grayed out plans C and F since they are no longer offered to new enrollees. Now, some of the choices on this chart are limited coverage, particularly for Part B coverages. So most people look at plans G and Plan N. Note, I've added some 2025 figures at the bottom of this table. For the high deductible plans, there is a high deductible Plan G, and the plans K and L, which have maximum out-of-pockets. Now, very few people use plans K and L, but there are people who do use G, high deductible, and I've talked about that before, and I'll return to it in a minute. Plan G offers the broadest set of benefits for new enrollees. It covers everything but the Part B deductible. In fact, plans C and F, which had covered that, were phased out mainly because Congress wanted everybody to have some skin in the game. Plan G is the most comprehensive and most popular and the most expensive. Here in New Jersey, premiums start at $155 a month for a 65-year-old male. Plan N covers everything that Plan G covers except Part B excess charges, and uses these modest co-pays of up to $20 for an office visit and up to $50 for an emergency room visit. In exchange for those co-pays, monthly premiums start at $111 in New Jersey for that 65-year-old male. That's about $40 less. Now, some are scared off because Plan N doesn't pay for those excess charges. But Medicare.gov offers a very easy way to ensure that your doctors accept Medicare assignment and agrees not to bill excess charges. Also, the Kaiser Family Foundation reports that only about 1% of doctors have opted out of Medicare and don't accept Medicare assignment. When I did my original research into Medigap plans, I also looked at Plan G High Deductible, which offers much lower monthly premiums in exchange for a very high deductible that's linked to inflation before your plan begins to cover the 20%. If you'd like to see why I did not select this plan, please look up there and click that video. Now, Telos Actuarial publishes these numbers, and this is the updated report through the third quarter of 2024 about newly issued policies. It found that Plan G continues to be the most popular plan for new enrollees. Over 60% of issued policies in each of the last 5 years have been Plan G. But Plan N has been catching up. It's now the second most popular plan, and as you see in 2024, it's almost approaching 20%. Now, it's been steadily gaining ground over the past several years and now clearly outsells Plan F, which is still available, again, to people of a certain age joining Medicare. 3 years ago, when I originally chose Plan N, I built this little spreadsheet and compared the monthly costs of Plan G and Plan N that I was quoted in my immediate area, and I noted there was about a $42.75 difference. And if you look at the totals there for the year, multiplying everything by 12, and if you divide that $20 copay, and again, that's up to $20, into the yearly difference of $513, I'd figured you'd need to see the doctor twice a month to catch up to the higher costs of Plan G. Now, I ended up choosing Mutual of Omaha, and I originally paid about $112 for the first year, in part because they gave me the household discount, even though my wife was not yet on Medicare. However, when she didn't sign up in 2022, my rate went to $124 in 2023. That was an increase of about 10.8%, but most of that was the loss of the household discount. In 2024, my monthly premium went up 4.5% to about $130 a month. And in the coming year, it'll be up about 7%. Now, still, I think Plan N is about $40 cheaper than I believe I'd be paying for a Plan G by now. It is a attained age policy. Now, if you're 68 and on a Plan G in New Jersey, what are you paying a month? Let me know in the comments below. Now, I used the average of the 10 lowest Plan G and Plan N policies in my part of New Jersey to update this little spreadsheet. If you divide that up to $20 office visit copay into the $511 difference, you would see that a 65-year-old male would need to visit the doctor more than twice a month still. I believe that unless you're visiting a doctor more than twice a month, the premiums plus the copays under a Plan N will not surpass the higher premiums for a Plan G. But if you are seeing a doctor that often, maybe Plan G is right for you. Hey, before I go any further, will you please like, share, and subscribe to this channel and hit that bell notification? The more you do that, the higher this will be in the YouTube search algorithm. So I took the new numbers and I updated the inputs on my comparing spreadsheet with those averages. Now, I also doubled the number of office visits to 4 primary care visits and 4 specialists, since some viewers of my video a year ago thought I was too low in the estimate of care. I'll tell you, I don't see a doctor 8 times a year, but for the sake of this experiment, I increased that. And I've also updated this with the 2025 Part B deductible and Part B premium levels, since the plans, either Plan G or Plan N would pay those as well. Now, I continued to use longer-term average increases for Plan G and a slightly smaller average increase for Plan N. And again, these are averages. My increase in 2025 is 7% for Plan N, and I've seen averages in the state of New Jersey for Plan N that are 8%. So I'm doing a little bit better than the average according to the industry surveys. But I also say you wouldn't see that every year. The averages over time are going to be the numbers that I've been using. All right, so I updated those numbers and I go to the main comparing worksheet in the spreadsheet. Now, I am not live on my laptop here. This is a presentation I'm recording. But if you want to go through the video a year ago, it tracks how this whole spreadsheet works. What I did was I tracked the monthly premiums on the far left, then multiply those by 12 to get the annual costs, add in the total healthcare costs to include the co-pays under Plan N and the deductibles under Plan G to give you the total healthcare costs and then a cumulative total. And the charts on that spreadsheet show that the annual total estimates for premiums for the Plan G plus the Part B premium and the Part B deductible will still run higher than the annual total estimates for Plan N with the Part B deductible and the Part B premium, even if you add those modest copays. And again, that's 8 office visits a year. You still wouldn't catch up. I also ran them all the way down to age 80 with the inflation factors that I put in the spreadsheet. And I figured that I'd spend just under $100,000 on a Plan G. And I'll spend about $86,535 on Plan N. A significant savings in a DIY retirement. Now, I'm on Medicare, but my wife is on the Affordable Care Act marketplace plans for her insurance. And this is the time of year that you shop for those as well. Now, I've noted that we're in this catch-22 where we found out that the premium tax credits are based on your household income, but you're only purchasing for one person. And so they don't go as far. We found out that paying for one is almost as much as we were paying for two when we added my Part B premiums, Medigap Plan N premiums, the Part D premium, and total premiums cost in 2022 reached $1,035. Now, in 2023, total premiums went up more than 7% to $1,112. And in 2024, premium costs went up 12% to $1,246 a month. And in 2025, with a slightly higher projected modified adjusted gross income, I now expect to pay significantly more for the ACA premium, and we're going to spend total of about $1,493 a month in healthcare premiums in the coming year, and that's nearly 20% higher. But that's just the increase in premiums, which is based on how much modified adjusted gross income we decide to take in this DIY retirement. You also need to add the out-of-pocket costs too, and include in dental and vision, which aren't included in my Medigap coverage. Now, these are not based solely on inflation. In fact, they're based on real-life things like what kind of medical care you need in a given year. And so I went into my Quicken transactions and looked at medical costs over the past few years. And I figured out that the projected costs in 2025 will be a little bit more. So based on these total numbers, Medical costs were flat in 2022, increased about 9% in 2023, go up about 3% here in 2024, but will go up about 8% in 2025. Now, time will tell if that's the way it works out. Again, it's based on real life stuff too. But I do look forward to the time when we were both on Medicare because I believe that we will see healthcare costs reduced by about a third. I will conclude with my standard warning. I am not a professional. I'm not a broker. I am not a financial planner. I have no initials after my name, so take these as entertaining ideas from one DIY retiree to another. Always do your own due diligence and seek out a professional if you need one.